I know it's hard to admit, but you have anorexia nervosa.
Anorexia nervosa is commonly known as an eating disorder where they refuse to maintain a minimal weight for height and express an intense fear of gaining weight. Common signs and symptoms are distorted body image, push food around on their plate, restricted calorie intake, significant low BMI, approximately 8, bradycardia, amenorrhea, cardiac arrhythmias, cold extremities, yellowing of the skin, constipation, and muscle weakness. No FDA medications have been approved for anorexia, but some that are commonly used are Prozac, which is an SSRI. It may help with obsessive compulsive behaviors after maintenance weight is reached. Zyprexa is a mood stabilizer or antipsychotic and can be used to improve mood, decrease obsessive compulsive behaviors, and resistance to weight gain, but is not well accepted by patients who do not want to gain weight. These medications are contraindicated if the patient has hypersensitivity, use of MAO inhibitors, history of seizures, diabetes mellitus, hepatic impairment, and cardiac dysfunction. Adverse effects can include suicidal thoughts, chest pain, orthostatic hypotension, sexual dysfunction, serotonin syndrome, and GI and visual disturbances.
I think you know you have a problem. You have bulimia nervosa.
Bulimia nervosa is when a patient is engaged in repeated episodes of binge eating followed by inappropriate compensatory behavior such as self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting, or excessive exercise. Some common signs and symptoms seen in bulimia are dehydration, enlargement of the parotid glands, dental erosion, depression, impulsive behaviors, cardiac arrhythmias, orthostatic hypotension, Russell signs, and esophageal tears. Both Russell signs and esophageal tears are when callus are formed on the knuckles due to self-induced vomiting. Some medications that are used for bulimia are antidepressants. Along with antidepressants, they can be used together with cognitive behavioral psychotherapy, which has been shown to bring about improvement in bulimic episodes. There has been limited research that has shown that SSRIs and tricyclic antidepressants help reduce binge eating and vomiting over short periods of time. Some examples of these are Prozac and Wellbutrin that can help prevent relapse. Due to Wellbutrin's increased risk for seizures, it is contraindicated in patients who purge. Other alternative measures to help focus not only on the disorder but also on helping the patient is meal planning, use of relaxation techniques, maintenance of healthy diet and exercise, and coping skills. Some adverse effects seen with the medications is orthostatic hypotension, sexual dysfunction, serotonin syndrome, and GI and visual disturbances.
It should come as no surprise to you that you have binge eating disorder.
Binge eating is when a person has recurrent episodes of uncontrollable binging after they express significant distress. Binging episodes induce guilt, depression, embarrassment, and disgust. Common signs and symptoms are GI problems from stomach dilation, heartburn, dysphagia, bloating, abdominal pain, and obesity, and they are at risk for hypertension, diabetes, and heart disease. Medications that are commonly used are SSRIs to help with short-term depression, but relapse often occurs when regimen is complete. Belvic is a medication that makes the patient feel full after small meals and is used with diet and exercise. Phentermine is a medication that will make the patient have a fullness, reduced taste, and quicker calorie burning. These medications are contraindicated if the patient is pregnant, breastfeeding, severe renal impairment, glaucoma, use of MAO inhibitors, and hyperthyroidism. Adverse effects can include headache, dizziness, fatigue, nausea, dry mouth, constipation, backache, and cough.